I'm glad to see that you've taken the plunge and you're now in the timeline. In particular, you're in the research component, which is really perhaps the most important part of the entire process, because the way I look at it, you're looking at two important things. One, perhaps three. One, do I have gynecomastia? Two, who's a good plastic surgeon to go to? And three, what can I expect? So in terms of do you have gynecomastia, I really actually don't even answer that question very often in consultation, because when patients come to me, they've experienced pain. Pain such that they're not able to take their shirt off at a pool party. They're not able to go to the beach with their friends, or if they do, they won't take their shirt off. And if they do take their shirt off, they're constantly focusing on it. They base their wardrobe on how the clothes fits based on their chest. So in terms of diagnosing what type of gynecomastia, there's a section on that. And that's very, very important, because you have to know where you're starting with to know where you're going to end up with. The other variable, of course, is finding a good plastic surgeon, but you have to diagnose at least what type of gynecomastia you have, and then go through what your options are in order to achieve the result that you want. And then finally, finding a good plastic surgeon. I don't make recommendations, because that's not what this site's about. The site's about making sure that you find someone who is good, and you're going to know that. A good plastic surgeon is going to have a lot of reviews, talking about gynecomastia in particular. He's going to have a lot of before and afters, and that's the big difference here on the timeline, is that we're not just showing before and afters, we're showing the whole process. But really remember that surgeons are showing you their best. So if they can't show you at least a few of their best, then they haven't done that many. And finally, make sure that when you call and you talk to the office, that you get a good vibe. The office should know about gynecomastia. They should be able to answer some pretty high-level questions, because if they've seen it enough, they're going to know that. So look through this, get that information, and you'll get the result that you're looking for.